Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Brigitte Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello, nurses, and welcome to this episode of the Functional Nurse Podcast. I am very excited today to have our guest, Julie Davey, with us. Thank you so much, Julie, for being with us today.
Thank you for having me. I'm very excited.
I am going to start by going over your bio, letting everybody know kind of your background a little bit, and then we are going to get started. Julie is a nurse practitioner. She has over 25 years of experience in healthcare. She received her undergraduate degree from the Medical College of Georgia and graduate degree from Emory University. She holds a faculty position at Emory University, teaching future nurse practitioners, and she is currently enrolled in Functional Medicine University to become a certified functional medicine provider. In 2013, Julie became interested in a more holistic approach to wellness, and she began educating others on the power of food and natural medicine to heal the body. Today, Julie owns a virtual consulting practice helping patients get to the root cause of their symptoms through innovative clinical testing. She takes a holistic approach to healing the issues uncovered through proper testing in order to restore energy, proper digestion, mental clarity, promote better sleep, skin, immunity, weight loss, and so much more. With over 20 years of gut issues herself, Julie is especially passionate about gut health and helping others to get to the root of their issues in order to heal the body. She's a member of the education team at Rupa University, where she teaches quarterly boot camps on the GI MAP test and leads a mentorship program for providers interested in building their own functional medicine practice and becoming well-versed in gut health. Education, whether it's for providers or patients, is Julie's ultimate passion. And I think we totally have that in common. So welcome and thank you for being with us today.
Yes, thank you for having me. It's an exciting conversation. And this is such a great thing that you're doing in helping other nurses. I mean, this is so needed in sort of really getting more awareness in this sort of functional medicine space,
I think it's long overdue. Yeah. And so everything I just mentioned in your bio is like a topic that I know that my listeners are interested in. So I would love to start with your journey to becoming a nurse practitioner, and ultimately finding functional medicine.
Yeah, gosh, if I think back to, what sparked my interest in nursing. Interesting. In high school, actually, we had a health education. I don't remember the exact name of it, but a health education course. And basically it was sort of learning to become, now that I look back, a medical assistant, basically. But I remember I was just really kind of fascinated and just very interested in that. And so I thought, I think I definitely want to do something in the medical field at that point. That sort of really sparked my first, interest. And then as time went on, I went and got my associate degree. And then I thought, I think nursing, there are a lot of options, right? I mean, I never, even now, I mean, people ask me, should I go to nursing school? I mean, I always encourage people. That is such a great path to take because you have so many options. There are so many things, that you can do. So I decided to go to nursing school, went to, as you said, the Medical College of Georgia. Then I worked for a few years in the ICU, in a cardiothoracic ICU. And at that point, I loved it. It was great, but I knew I wanted to do more and really have a little bit more autonomy. So I decided to go to nurse practitioner school. I went through Emory's acute care nurse practitioner program. And after that, I worked in a cardiology practice for 20 years, I think, right at 20 years, maybe a little bit more. And so obviously that was conventional medicine, which I learned so much. I loved it. And I certainly think that there is a place for both.
Absolutely.
I think an integrative medicine approach is great. I mean, we need conventional medicine at certain times, but if we can take more of a natural approach, that's always
Mm-hmm.
best to work with the body and help the body, heal at a foundational level. About, as you said, probably 10 or so years ago, I really just started being more interested in a holistic approach to healing. And really, it just started with myself, my family, wanting to remove toxins from, have natural tools to use if we got sick, things like that. So that's kind of where I started in my learning. And I started with the foundations with, food, with nutrition, with, exercise, moving your body, stress management, sleep, like all of those foundational things. And then I also became very interested in plant-based medicine. I started learning more, started teaching some classes, and I had a lot of people who were just interested in learning those things and how they could help their family. So that's really kind of where I started. In my community, I would teach classes. People would come, would learn how they could incorporate these foundational things. And honestly, Brigitte, it wasn't until probably months after I started doing that, I started to realize I could actually make a career out of this. I just did it at first because I loved it and I wanted to share what I was learning with other people. And then I started to think, oh, wow, maybe I could actually do this. And again, it become more of a career for me. And so then I was along this time, I had a lot of gut issues myself. And that was one of the things I was trying to heal from. Doing all the seemingly right things, foundational things, and did get a lot better. But didn't really get to optimal state of wellness and where I knew I wanted to be. At that time, I had discovered the GI map test and took the test. And honestly, it was so overwhelming when I first got the results. I thought, wow, I look really sick on paper, but seemingly from the outside, I didn't look sick. I seemingly, was pretty healthy. And I had H. pylori. I had, which so many people do, I had 2 parasites, dysbiosis, almost non-existent immune system. I wasn't digesting and absorbing fat properly, tons of inflammation. But it was a little overwhelming, but it was also so enlightening that, oh, I have some answers now, so I think for people, if you're doing all these foundational things and you're still, something's not right, then maybe looking at, getting some data through testing is maybe the next best step. So I took the GI map test. And again, I worked with a dietitian at the time because I wasn't offering it in my practice then. And so I had to go through 2 protocols. Ultimately, got so much better. All of my symptoms were gone and just felt great. And so I thought, wow, this is what I really want to help people with. So really kind of like, forming your niche, or, understanding what that is and where you really want to go. That was just a whole process, right? So I started working with people on GI mapping. And then I, at one point, had created a course with a colleague on GI mapping where we were teaching other providers how to incorporate it into their practice. And then through a podcast, I was connected with Dr. Carrie Jones, who was the head of medical education at RUPA at the time. And she interviewed me for the podcast. And then she said, do you want to teach a boot camp on GI mapping for RUPA? And I said, yes, I'd love to. So, and again, during this time, I also have been teaching at Emory in the nurse practitioner program that I went through for now, I think 21 years. And so I love education. So it was just like a perfect opportunity for me. So I thought, yes. And honestly, at the time, I thought it was going to be just a one-off thing. We're going to teach this one boot camp, great. But then it turned into, well, hey, we want to do this quarterly, because we have other practitioners that are interested. So I ended up joining RUPA, and it's just been such an exciting journey. So that's kind of, I know that was a long answer to now.
No, that's wonderful. That's exactly what I want. I know that's what my listeners want because I get a lot of feedback on, what they love hearing, and they love hearing other nurses tell their story. You're ahead of a lot of my students in your practice, obviously, right? As far as incorporating holistic things in. And so I think it's so inspiring for other nurses to be able to hear that. And you keep mentioning teaching, right? And we have that in common, big passion for teaching. And then when we talk about scope of practice, it's like so much of our role as a nurse and a nurse practitioner is educating people so that they can take control of their own health.
Yes, absolutely. Yes. And that is, you and I were kind of talking before we actually started recording about the fact that if you think about all of the different disciplines in medicine in general, I mean, nurses are just at the core of education. We're the ones there with the patients, whether it's in a conventional setting or a functional setting. I mean, we're the ones there that are really not only educating the patients, but often just kind of walking with them through the journey, which I think is just so important. I mean, nurses are just invaluable. So yeah, I think it's a huge part of our role.
You know, we have in common, I worked with a post-op open heart patients for a long time, and cardiology was a big part of and so much of that is the nurse providing education and caring for those patients after surgery is such an intimate time of teaching, really, you know, like you spend so much time with them. So it is interesting when we talk about like roles in healthcare that nurses spend so much time with patients and they spend so much time teaching. And we have the same background in those two things, and then going on to teach nurses, which is really cool because like you were talking earlier about your story to becoming nursing. And I was thinking, at what point in that journey did either of us think, oh, we're going to teach someday, you know? But it's just, I think maybe it's a little bit of a nursing calling is to educate others too, whether we realize it or not.
Yeah, I think so. And I'll tell you just quickly, just a little funny. When I was in nurse practitioner school at Emory, at that time, you could take an elective. And I decided to take this teaching elective. And I was, before I did that, I didn't like to speak in front of people. I was, it was like, no, I don't want to do this. And so I thought, after I started the elective, I thought, why did I do this? Because part of that elective was to teach the BSN students health assessment class. It was like one of the classes in their health assessment course. And it was to like over 100 students. And I had never spoken in front of, certainly a group like that. And we videoed, everyone did it, and everyone got videotaped, and then you could go back and you could watch your videotape. I was so nervous, but I remember after I did that, it was almost like it was very empowering, and I realized that I loved it. Like I felt like it gave me a lot of energy, and I thought, gosh, is this something that I would potentially want to do? So it was fun. It was exciting. And then after I had graduated, it was about 3 years into my nurse practitioner career, I maintained really sort of a friendship with one of my instructors and mentors at Emory. And she was leaving, and she said, hey, do you want this position? I'll recommend you if you want to interview for the position. And I was like, okay. And so that's really how I got into education, and just have realized over the years how much I really love it. And then being able to move, from that into more functional medicine and education in that space was just really exciting for me. And honestly, one of my favorite things to do also is, I know we didn't really talk about this, but with my virtual consulting practice, like that's one of my favorite things to do is get on a consult and just educate the patient that I'm working with, one-on-one. I love that. So yeah, it's all about education.
Absolutely.
Really.
Yep. And so now that I know that you also have spent some time teaching with BSN students, scope of practice is a big topic for my students and my listeners, I think overall, and every state's different, of course, right? Because I think you and I have really different experiences with scope of practice, I imagine. So could you talk a little bit about your thoughts on we talked a little bit before we hit record about what functional medicine really is when you get down to it, and the role of nurses in that. Can you just share some of your thoughts on your experience, just like nurses and scope of practice when incorporating functional medicine into their practice?
Yeah. So we are much more restrictive here in Georgia, but what I love is, first of all, we know that, let's just put testing aside, right? Nurses make great educators because, again, like we said, that's a big part of our role. So I think if you have a listener that is looking to start a practice, I think starting with the foundations, you don't need any type of, licensure to order testing or anything like that. If you're just kind of starting with the foundations, what you're putting into your body, how you're moving your body, what does your sleep, your stress, all of that look like? And as well as I do, you can really make some really great progress and often get people really to to meet their goals and to where they want to be by just doing those foundational things. Then I think, if you've, maybe you're looking to start a practice and you start there, then maybe over time you think, okay, well, maybe you have some patients who you feel like you need to dig a little bit deeper and you want to look into, some functional testing. I think we have such great opportunities now with platforms like Rupa. So I am going to plug them a little bit here because they're amazing, honestly. And I'll just tell you, not only is their platform great, they are the heart of the people that work there. They just really have a heart of service and really want to help people. So I can just tell you, just from coming on from first I was just contracted to do boot camps, but now that I've come on in more of a full-time role, they're just great people all around, to work with. But their platform is amazing. And for nurses and other disciplines that don't have authority, so to speak, to order testing, they don't have an NPI number, they can't necessarily order testing. You can partner with Rupa under their physician partnership program where you can order testing for your clients. So I think that is a great place. If you're already working with people on the foundations and then you want to dig deeper, start to learn more about these different tests. Maybe it's like it was for me. Maybe it's gut health or maybe it's hormones. There's so many different options, and they offer a lot of boot camps to where you want to kind of hone in and focus in on one specific area. But that's another thing that I would also encourage people to do is sort of really think, what are you most passionate about? What excites you? How do you really want to help people, and sort of really find your niche and who your ideal client is and take that route. So, it's exciting.
I'm thinking when you started saying this about before Rupa, I know you know what I mean. Finishing up with a client and now you have to go order all these different tests, and it's like, let me go log into this website and order something and then go log into this one, or to have somebody do that for you. It's just such a hassle. And once Rupa made it where you could just go in and boop, 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 and you're done, it's like it changes your practice. It really does. And as far as like labs and scope of practice, if anybody listening hasn't listened to, I have episodes specifically on that topic of like, it is a responsibility that a nurse practitioner or physician has to take responsibility for critical labs. All that's really important. And so I am so grateful that Rupa has created a way for that to not get overlooked, right? That like there's still somebody taking responsibility for a critical lab value. But at the same time, we're increasing the opportunity for nurses to partner with patients and work on lab work that they might otherwise really struggle to get done because, everybody in healthcare thinks that these labs are necessary. Which reminds me, you were saying earlier about the stool testing and you said SIBO, and then you're naming off all the other ones. And I was like, you said H. pylori. And I was thinking, I think that's the only one you listed that like we learn about in nurse practitioner school. But when we help people on stool testing with results of all the other things you mentioned, they get better. But it isn't coming up in school still. It still isn't.
It still isn't, unfortunately. And I have had some conversations around that because, fortunately, I am in a place where I can bring up those conversations, but maybe we're in the conventional space not really ready for that just yet. I hope that we're moving in that direction. I have students now that will ask me, well, tell me about like what you're doing now. Because I can tell you from going to nurse practitioner school, did I ever think that I would be where I'm at now, having a virtual consulting practice, getting to work from my home, having time and financial freedom? No, I never thought that, because as nurses and nurse practitioners, we work really hard, right? And it can be, and we work a lot of long hours, and just to be able to have other options and really just to help people heal from really, getting to the root of their issues, I think is just so, so important. So yeah, I kind of got off on a tangent on that. So
you went right where I wanted to go with this, because the next thing I wanted to ask you about is we can have these conversations in some settings, and sometimes it's a little bit more taboo, or, it wouldn't go over well. And I taught pre-licensure nursing students in the past. And so it would come up and I would try to make the connections, especially with the foundations, right? Because I didn't want to overwhelm them talking about stool testing or something. But what kind of conversations are you having with your students about like, how much is it coming up now? Are you able to like add it in when you're teaching, or what are you experiencing recently with that?
Yeah, that's a great question. It comes up more in one-on-one conversations. So versus in, a big classroom setting. I mean, I'm teaching classes with some classes are as few as 20 students, some are as many as 200 students. So, if we have a specific topic that we're covering that day, we may mention some, natural like tools and options in a talk. But other than that, it's a little bit challenging maybe to incorporate it. But where I find that people get really curious and I can really have a great conversation is I see students in their clinical settings. So I'm the clinical placement coordinator. So I set students up in their settings, and then we have multiple instructors that go out and see students. And I usually still take a group of students that I'll go see in clinical. And so we talk a lot about where, especially once they get towards graduation, where they want to work and what they want to do. And so a lot of times conversation comes up with what I do. And then I can just see like these like light bulbs like, whoa, what? Almost didn't really know that was an option. And the other place that I see it often too is, so when I go out and I see students in clinical, I have conversations with the preceptors too. And so these are typically people who have been working for at least several years, maybe a lot longer in a conventional setting, and they get burned out. Right? They're like, I got into healthcare, into nursing because I really wanted to help people. I love helping people, but sometimes I don't think that I'm helping them in the best way. And so we'll have conversations then around that. And often I have referred preceptors to, or, other colleagues basically that I come in contact with in that way, to places like RUPA or to education, to go and seek some education in the area of functional medicine. So for me, that's kind of more along the lines of conversations that I've had is probably more one-on-one, which kind of is the best conversation,
Well, and it's where we're at right now. You may relate to this. I feel like when I was an RN and I felt this stir to like do something different, like you were talking about, you're in an allopathic practice and you're like, this isn't filling my cup anymore. What do I want to do next? I really thought that NP school was going to do that for me. And then I get in the program and I realize that they're teaching us to work in a medical model. It isn't more advanced nursing as much as it is, here's how to diagnose and treat. And so I was really excited. I worked in primary care for 4 years to be able to partner with patients and see them through their health journey in a much greater fashion, kind of like you in cardiology, to get to see them outside the hospital setting, non-emergent, provide teaching, but then you have the time constraints and figuring out which patients are ready to hear more and so for me, I feel like when I found nurse coaching and functional medicine, I finally found who I wanted to be as a nurse, and how little of that came from becoming a nurse practitioner ultimately for me was incredible. And so many of my students have said that. They're like, oh my gosh, yeah, you're like, where's the more that I really wanted? So I have a feeling you're in the same boat.
Oh my goodness. Yes. 100% agree with everything that you just said. I mean, but no, I will say this too, because if we have people that are listening that are like, maybe somebody's in nurse practitioner school now and they're like, oh gosh, what am I doing here? I will say I am grateful that I have this foundation. And also, I mean, obviously more learning is never a bad thing, but I do also find that it gives you a little bit more credibility with people sometimes. They're like, oh, they see you as more of an advanced provider and more of a sort of, you have a broader scope, so to speak. So I think that that's helpful. So I just wanted to say that in that it's never lost. And you can take that degree and you can build on it with more, functional medicine learnings and certifications and things like that, and create a practice that you want, that you love, that you're passionate about.
You were talking about niches earlier, and it is so cool to see my students will realize what they want, something they never thought they'd be really into. And then some of them will say, okay, I thought I was going to become a nurse practitioner until I started this course. And now I can see how much I can do in my scope as an RN. But the opposite happens too, where so many of my students will say, I never wanted to go back and become an NP. But now that I realize what I could do with that in functional medicine, I'm inspired. and it is a journey, right? And it costs a lot of money. And so it's so fun to see everybody goes, like, I never thought I'd be an entrepreneur as a nurse or an educator. We all go into nursing, and then, like, the sky's the limit with any direction you want to go and what you want to do with it next. So you're right. You're absolutely right, because there are things people ask me, would I get my NP again now that I've learned functional medicine? And I'm like, well, I would have never gotten the jobs I got. I see it that way. I wouldn't take back anything. But do you need to become a nurse practitioner to really have a huge impact in people's lives practicing functional medicine? No, absolutely not.
Yeah. And I think that's such a great point that you made, Brigitte, is that everyone's on their own journey, right? And here's the thing, you may not have this next opportunity had you not had this foundation of whether it's an RN or you choose to go back and be an NP. Every step, I think, just prepares you for the next one and opens up opportunities that you may not have had if you had not have had this foundation. So yeah, I think that that's so important. And I love that you're kind of speaking to a multitude of people here. I mean, even though it's nurses, there's, like you said, there's so many different avenues that you can take in the field of nursing, and being a nurse practitioner isn't going to be for everyone. A nurse with experience and functional medicine training can make huge impact and maybe doesn't even need, to be an NP to make that huge impact that they're meant to make. So I think, I love that. That's so important to say.
A lot of the teaching that you were talking about, you've done for your clients, and group work and local classes for student or for to work with your patients. All of that is stuff that I try to encourage my students to do. If you want to build a practice, start by teaching people in groups in your area, or even offer free courses, something to where you're getting in front of people and they're like, wait a minute, I haven't heard this before. And they go home and try it and they feel a little bit better. And they're like, wait, who is that Julie lady? I'm going to go see her now.
Yes, that is you are absolutely right. That is where it all starts. Putting yourself out there, getting in front of more people, even just helping people make some small changes where they see sometimes huge differences. And then they've bought into this whole more holistic way of healing and treating the body, And yeah, so I think that's
okay. And on that line, I want to shift gears and talk about, you talked about teaching the GI map. I've heard you talk a lot about gut health before. And so I would love for you to share a couple, a lot of people that are listening to this have taken some program for gut health. And so they're speaking our language already, but I would love for you to share a couple of your pearls for gut health, like what you have learned from looking at tons of stool test results.
And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on-demand contact hour courses to the full functional nursing program, designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. If you're looking for connection and real-time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode.
Well, I'll tell you the biggest thing that I have learned, and I can share just a little bit about this. I had to learn through myself too, in my journey, to healing my gut. I was just doing a consult with another provider before we hopped on the podcast. And I did 2 this morning, and the same thing came up in these 2. And that is the impact that stress has on your gut. What we see even on the GI map. I mean, we were looking at this GI map on this one of the practitioners that I was speaking with this morning, and we were looking at this GI map, and this lady she had H. pylori. She had 4 parasites. That's probably the most parasites I've seen on a test. Just her intestinal health markers were just all out of whack, so to speak. And when she gave me the history on her, it was just like stress. She had a lot of things from her childhood that she hadn't worked through, a lot of trauma. She also had a lot of anxiety now she had a traumatic birth with her son. All that to say, I think it is something that we do that has a lot more awareness around it now is stress. But from my perspective, because I work with clients on their gut health, I just see the huge impact that it makes on the gut. I shared a little bit about my journey and things that I saw on my GI map test. I ended up needing to do 2 protocols. Once I got through that second protocol, I was probably 80% better, but I still had some symptoms. I still was like, and my GI map looks so much better. What else is going on? Well, I had this huge stressor in my life at that point. And I can tell you, once I finally worked through that and removed that, it was almost like a light switch. My symptoms went away completely. And it was that like profound to me. And so I try to, when I work with clients, to really help them understand. We talk about it in society. Stress does this, stress does that. But I think a lot of people are like, well, we live in a stressful world. We can't get rid of it. And that is absolutely true. But there are things that you can do, foundational things that you can do, and you can begin to incorporate to lessen the stress. And I just think if I had to pick one thing that I see impacts gut health so much that maybe we need to put even more emphasis and attention on, it would be stress for sure.
Yes.
Yeah.
I think one of the most powerful questions, and when you were talking about having conversations with students in clinical, when they're practicing, is what happened right before that, that we don't ask enough in healthcare about, well, what's been going on lately, or what was going on right before that happened, and the light bulb that'll turn on for people when you ask that question.
I think, like you said, asking questions of what happened right before whatever event brought them in to see the provider. I think it's our job really as nurses, nurse practitioners, to not only be really great investigators, right? We have to ask all the right questions, but we also connect the dots. We also help to connect the dots, not only for our purposes to help the patient, but just for the patient, just for the light bulb to see this is why maybe this happened or how this all works together. I think that's so important.
Yeah, that's true. And I was thinking when you were saying that too about you and I are our younger selves in the ICU running back and grabbing food. I use this example all the time. I'm like, let's take a nurse in the hospital working, let's be real, 13-hour shift, right? By the time you give report.
Absolutely.
At what point were we in a resting and digesting phase? I'm like, it's a miracle I'm still alive and my thyroid survived that. Like what nutrients actually made it into my mouth and into my, actually got absorbed?
Got absorbed? Yeah. Right. Yeah. You are so right. And that's one of the reasons that I love talking about things like this with people like you, and hopefully, sparking some ideas within nurses that nursing is such a great field to be in, and we need bedside nurses. Yes. And there are so many, nurses that they are passionate about that, and that's what they want to do their whole career. And we need those people. I would also say that, gosh, nurses can get so burned out because it's a hard job. It's a hard, position to be in. If that's you and you're listening, you've got a lot of other options. Maybe this is sparking okay, I don't want to do this for the rest of my life. I want to help people, but in a different way, a way that, feels better to me, and that I maybe feel like I'm helping people on an even deeper level. So yeah, that just kind of brought into my mind how hard really can be to be a nurse, how challenging.
Yes. And my students are everywhere. One of my favorites is school nurses. I always talk about that because I'm like, oh, that's so fun. They can impact when they have the time, they can impact not just the child, but the family and a community.
Oh my goodness.
I have lots of students that are still working in a hospital setting or a long-term care facility, and they are finding opportunities to weave in what we do. And it is really inspiring them. It's reinvigorating their practice. And I had somebody on previously that I interviewed, my friend Ashley, and she was talking about when she was learning functional medicine and then going back in the hospital setting and sharing it with a patient that had just been newly diagnosed with MS, and talking about Dr. Walls. And now we've I've had a conversation with her about that nurses are able to take this and inspire patients in like every setting. It applies in every setting. We just have to figure out how to squeeze it in sometimes.
Yes, I agree 100%. And I'm hopefully as we continue and there's more awareness, there's going to be more of this incorporated into nursing school and nurse practitioner school. And
I say sometimes, I hope someday we don't need my course, right? Like this is just something that all nurses
of the program.
Mm-hmm.
Yes, I love
so
that.
If we can segue off that and take your gut health wisdom and your experience helping people with that, and then go back to what I was just saying about a nurse can share some of this education in any setting and help people. Can you talk a little bit about just like using food? Because that's a huge thing, right? And like I'm creating a nutrition course right now for nurses, and it's all about how, food has such a huge impact on our health. And so when we talk about scope of practice, every nurse can teach their patients more about what goes in their mouth and what happens when it gets in their body. And so your experience, I'm sure like would be inspiring for a lot of people if you could talk a little bit about just using food and how that's been.
Yes. And I think that's obviously so important. And I see probably work, I would say probably 50-50 with one group of people who they're kind of like me. They had tried all the things and they have all the foundations pretty much down, and they know that there's still something they're missing. So then they want to undergo testing, right? Not everybody needs to undergo testing at first, at least. If you don't have the foundations down, that might actually be all you need. And of course, food and what you put into your body is really, in my opinion, the number one foundation. Certainly there are others, that are really important as well. But especially if you're listening and you're just starting out and you're getting more into, a functional or holistic approach, that's where you need to start, is eliminating some of these toxins, and even just simple things that you can tell people to do with hydrating. And if you drink sodas, replace one a day with a glass of water, and you start to see how much better you feel. So I think when we're talking about just food, nutrition, all of that in general, microing it down so that it does not seem overwhelming. Because if you tell people to go from eating out 5 days a week and going through the drive-through and drinking sodas to only eating whole foods and organic foods, and it's probably not going to go over so well. They're going to fall off by day 2, probably. Maybe not, but just in my experience, I think if you can just micro it down. But yeah, like you said, that's really the foundation, the fuel of our body, right? And so the other thing too, I think to consider is, if you perhaps are already doing really pretty well on the diet and you still have a lot of symptoms, that would lend me to think, are you really absorbing the nutrients that you're eating? So I guess until, I don't know, several years ago, you just think, oh, I'm putting all these great things into my body. But it's not, you've heard, it's not, you aren't what you eat, you are what you absorb, right? Are we actually absorbing what we're putting into our body? So I think that that's just so important. But yeah, the foundation should always be nutrition. And if you're working with clients and they come to you and they're like, maybe they do just want to get tested, I would say, let's get these foundational things down first. And start out in ways that are very doable for patients to make these transitions. I think you're going to have much greater success, and they're going to buy in, right? They're going to start to feel better, and then they're like, oh, this might actually work. And then they want to do more and do better.
Because if you tell somebody, oh, no more soda for you starting today, and they're not successful, they're what we would call them non-compliant, right? Like, oh, they didn't listen to me. Then are they really going to want to come back and confess to you that didn't go well for them? Where when we partner with people and we make small changes and they see a benefit to it, I think nothing is more motivating for somebody than actually working through an elimination diet and the amount of improvement that so many people experience with that. Then they're like, I need to go see what else she has to share with me.
Absolutely. Yes, you are so right. Yeah. So start there.
Yeah. Sure. And I think you really started touching on the next question I was going to ask you, is just about that idea of, I talk to my students all the time about, we can't waste people's money, their time. And so I feel like exactly what you just brought up is the direction that I try to have them go in, is recognize that when people come to you, my students will ask me, where do I start first? And they look at an intake maybe that they've done on somebody. And I'm like, it's always going to be the basics. It always needs to be the things that we're talking about right now, stress and food and toxins in their environment and in their nutrition and all kinds of things that they're exposed to. And then the testing can be for the people, like you mentioned, we're going to have people that are having more complicated things that aren't a heavier hammer because it's been going on for a long time, maybe. And so even with my RN students, I tell them, like, you know, you can find ways to get testing, but you could also partner with a nurse practitioner in your area or a physician and have a collaborative agreement in that I will have people come see you when we haven't made progress with foundations. But foundations help so many people. You know, that is the reason that we have an increase in almost every chronic health condition is because of our lifestyle, not because we didn't have fancy tests and prescriptions.
My goodness, you are so right. And here's the thing too, that you brought up another is just sparked in my mind. I'm always saying I'm not a fan of, and I'm sure you're not either, ordering tests that aren't going to change my treatment plan. I give this example all the time because I do a lot of GI maps and teach courses on that. You can add onto a GI map, you can add on a zonulin to test for leaky gut. Costs more money. And if somebody wants to do that, that's fine. That's their budget, right? So that's fine. But I don't really ever recommend that because if they have symptoms and they have pathogens and think they have leaky gut, I'm going to treat them for leaky gut. And I'm not a fan of ordering a test that's not going to change the treatment. So really the same thing. If you're not already doing the foundations, you've got to master that really before going on to, getting testing and knowing, where to create a targeted protocol.
Yeah,
so, yeah,
absolutely. And I think just the finances part, like if we can help somebody spend money on maybe some self-care, better food choices, vacation, but when testing is needed, I think it can have a huge impact, and they're not going to get it from their like Western medicine allopathic provider. I got hooked up with you when I was talking to Carrie Jones, who I interviewed recently. I was trying to get her to come on the podcast to talk about Rupa. And she's like, you have to talk to Julie because she can totally inspire from a nursing perspective, your audience. And so I wanted to give you the opportunity for a minute to just share a little bit more about what you're doing through Rupa. And you were telling me before we hit record. So I just wanted you to be able to share with them some of the things that we were talking about.
Yeah, absolutely. Thank you. Thank you for the opportunity because I have partnered with Rupa. I love them. I think they offer a lot of great support and education to providers like nurses, nurse practitioner. So I started out, I think I may have mentioned this, I started out teaching a boot camp on GI mapping. So January of 2023, I taught the first GI Map boot camp, and we had good response, and we realized that that was a need, that providers really wanted to learn more. So then we moved into quarterly boot camps. So we teach 4 of those a year, and it's not just on GI mapping. We have other educators like Dr. Carrie Jones that teaches a Dutch hormone boot camp. And there are many other ones. You can go to Rupa's website and see all of the boot camps that they offer. So that's how I started partnering with them. And then I also started writing articles. And until I started writing articles, honestly, I didn't even know that they had this option. So they have a Rupa magazine. It's totally free to subscribe to. I am not kidding you. Amazing information, not only for providers, but also patients. It's written in a way that patients can understand too. Any topic that you want to learn about, go in, type it in, and I guarantee you're going to find at least 1 or more articles on it. So that's a great, I think, resource to have. And then I also started doing some video content for them on just different gut-related topics. And Rupa's really, they started out more as, obviously a lab company helping providers to be able to have one central place to order all of these important labs. But then they've really moved more into also education. And so that's kind of where the boot camps come in. They have a ton of free classes too that you can go on and, listen to. And then we kind of wanted to take it to the next step because I know from just working with providers during these boot camps and, learning GI mapping, when you get out there in this functional space, many of us, and those of you listening, whether you already have a practice or you're looking to start one, it's most likely going to be virtual. And that's amazing because then you just have a lot of freedom in doing that. So, and there's not a lot of overhead and just all really great things, but it can feel lonely, right? You can feel like, gosh, I don't have anybody to collaborate with, like in the hospital. You can go and talk to your fellow nurse. You can talk to a nurse practitioner. You can talk to a physician. And so you're out here, you're trying to help these people and you're like, okay, well, I really wish I had someone that I could run this by or I could ask this question to. That I have seen over the past several years in just working with other providers and myself too. It can be lonely. So we kind of started to have a discussion around that at RUPA. And because they have such a love for providers and wanting to support them, we sort of came up with this, okay, let's offer this mentorship program where we're connecting a group of providers and we're helping them not only learn how to either build their business from the ground up or grow their business, and then also incorporate more, for me, for this mentorship, it's gut related, right? I think we're looking at doing other mentorships as well. But I can just tell you, just from starting this, it's been amazing. The first cohort that we have right now is a group of physicians, chiropractors, nurse practitioners, health coaches, dietitians, and the conversations have just been mind-blowing. I mean, and what we found as the common theme is people feel not only very lonely, but another kind of theme that has come up too is having imposter syndrome. One of the people in our group, the providers in our group, mentioned that, and just like, how do you ever get past that? And I said, let me just go ahead and tell you that I don't know that you ever not feel that way in some respects, because, I said at just starting this mentorship, I was like, okay, well, what if I don't have all the information that they need? What if I can't do this? I mean, even people who maybe you think are further along on their journey, we still have it. We still get into our head and can say, maybe I don't know enough. So if somebody's listening and you're wanting to start a practice, or you're just starting out and you're like, what if I don't know enough? You do. You just start. You start somewhere and then you learn as you go, and nothing's going to be perfect. You're not going to do everything perfect. None of us are, but you learn from that. You learn from failures. You learn from mistakes. And so all that to say, I think that having mentorships like this is going to be so great and so needed for providers in this space, so that we don't feel so
definitely
alone.
Yeah, because it comes up a lot, and I 100% relate to the lonely. I've talked about that because I had a tribe in the hospital, and like that isn't the case when you have your own practice and you're at home. And I love talking to my patients, but that's not the same as like being able to collaborate with your peers, like you're talking about. Imposter syndrome, 100%. I've talked to my students about even like starting the course, like creating the course. I was like, who am I to do this? But the truth is, just what you're saying, when you are helping somebody with foundational stuff, nurses undervalue how much we have to offer people and how confusing healthcare is for patients. And having somebody that's actually informed about what to eat, which of these crazy diets I heard about is the right one for me, or, why am I eating the right foods and they're not doing any, everything you've talked about today. And I can definitely testify the boot camps are great. I have new imposter syndrome because I did the true diagnostic one. And I'm like, oh gosh, that's a whole new rabbit hole. So I really love the RUPA boot camps because I tell my students, I'm like, I will never be the greatest expert in functional medicine. There are people that inspire me that are way ahead of me down one deep rabbit hole, right? Like they're like the cardiology expert or the endocrinology expert. And I was like, I do think that I'm an expert in nurses and like translating what functional medicine means to nurses. So the course that I teach is to lay that foundation. It's kind of like going to nursing school. It's like you get the whole picture, but you're not going deep down a rabbit hole like you do when you go work in cardiothoracic surgery ICU, right? Like then you get a mentorship there. And so I love the opportunities that are, IFM offers a ton of support for my students to be able to advance their practice, but it still isn't teaching them how to interpret testing if they want to add that. And the RUPA boot camps are perfect for that because it's a deep dive from the expert in that topic on how to use those tests effectively in the practice, because I think it's an ethical responsibility that if we're going to use these kind of things that cost a lot, that we really invest the time to be good at it.
Yeah, absolutely. And one thing too that I just want to say that popped into my mind as you were talking, Brigitte, about kind of feeling like you never know enough, or who are you to do this course or whatever. I think something that we don't think about a lot is like, you, Brigitte, can reach people that I could never reach. And Sally can reach people that we could never reach. And so I think sometimes we can get into this, oh, well, there are a lot of people in this space, or who am I really going to be able to help? No, there is plenty to go around, right? There are plenty. And like I said, there are people that, every person, every nurse practitioner is going to be able to reach a set amount of people that you and I couldn't reach. So I think that we have to keep those things in mind when we get imposter syndrome or think that we're not good enough or whatnot. The world needs you.
Everybody. I mean, we look at the rates of metabolic disease, cardiovascular disease, all those topics. People in your town need you. Sometimes we talk about like, should I say I'm a health coach and work outside your state lines? And I encourage nurses to a whole different topic, but never do that, because you are held to your licensure and accountable for that. And there are so many people in your town, in your state that need you, right? And there's no reason to put your license at risk to go find patients somewhere else, because the people next door to you need your help, right?
Yes, absolutely. Yes.
So before we wrapped up, I know you've been in the holistic health world for quite a while, and I wanted to give you the opportunity to share your thoughts with nurses considering learning and practicing functional medicine and possibly wanting to start their own practice like you did.
Yes, I would say do it. Like, just go for it. Start somewhere. Start by, let me back up. If you want to start a virtual consulting practice, there's literally no cost, or there can be no cost up front, right? When I started, I used Google Docs for everything to keep up with everything. There's no cost to that. Now I use Practice Better because I've grown and I have more patients, and you can invest in things like that as time goes on if that's what you choose to do. But there's no reason not to. People need more educators in this space. It's just a huge need. And like you said, people in your community, in your area, in your state, they need you. So I would say just start somewhere. Don't let fear overcome you starting and helping more people, because you're in healthcare for a reason. You have a heart to help people. You have a heart for service, or you wouldn't be in this space. And I think that taking more of that holistic functional approach is just an even better way to help people ultimately heal and really live the kind of life that they want to live. An energetic, vibrant life that's not full of disease and chronic conditions. So I think that, just start, because I think we found this in the mentorship. There's been several people that say, well, I've been wanting to start this practice. I've learned so much. This is another thing that happens. I take in all the knowledge, but then I don't put it into action or put it into practice. So you've just got to take that step, and I promise you it just gets easier, because you'll have some wins and then you're like, oh, this is awesome. I want to do more of this. And so it really does feed you and kind of keep you motivated and exciting, the more steps that you take in that direction.
I agree. I think it's so fun, like being able to help people with things and then come back and say, oh, that huge problem that I've had for a long time that's really crippled my ability to work or care for my children or be that person in my life that I want to be. And you get to help people truly heal rather than be like, okay, here's your new prescription, come back next year and we'll refill everything. It's fills my cup. It sounds like same for you.
Yes, for sure. Definitely.
Well, Julie, thank you so much for being on here today. I super appreciate it. I'm going to share in the show notes links to some ways for people to connect with you and follow you. And I absolutely encourage, especially if my students have completed the course and you understand the foundations, moving on to a course like the GI map would be ideal. And so you could take a course from Julie after you're done. Thank you, Julie.
Yeah, that would be great. Yes, we would love to welcome any of you that want to learn more about GI mapping or another topic. And these boot camps are 6 weeks. They're great. It's like you said, it's a deep dive, and then you have all of the information there that you can refer back to. So yeah, I would highly encourage that after you have the foundations down.
You're right, because
thank you.
Carrie has the Dutch testing one too. It's wonderful. So, thanks, Julie.
Yes, thank you so much for having me.
Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.